It's incredibly tragic. I think it speaks to the virus and its virulence. I think people think that if they're young, that they're immune to it, that they're safe from it, and that's not the case.
A 16-year-old has died of COVID-19 complications at Montreal's Saint-Justine Hospital, becoming the virus's youngest fatality in Quebec. In a statement to City News, the hospital confirmed the death, saying they cannot divulge more information on the fatality, citing privacy laws. Saint-Justine did say that generally a young person who dies of COVID would have had significant comorbidities, which are often chronic or long-term conditions. The latest Quebec data shows that those 10 to 19 years old make up 11.8% of the province's COVID cases.
We know that the variant is circulating in daycares and in schools. At the same time, even with the variant, we see that children have a less severe form of the illness. And when we see severe form, often in young person, often they have comorbidities, so they have other chronic illness that make them more vulnerable for those forms.
The variants of concerns that are circulating, which are more infectious, more transmissible, and somehow we think that these are leading to these younger hospitalizations. So it's a really rough time, and especially now with more and more variants being dominant in our regions, I think we need to continue to be precautious and take on all of these restrictions and take on all of the public health measures that we have and mask up and just avoid indoor gatherings.
In August 2020, 19-year-old Don Benny Kabangu Sapu died from COVID complications in Terrebonne, northeast of Montreal. His family had said at the time that the young man was considered healthy.
Even people who are healthy are suffering from this virus. So I would really urge everyone tuning in to just pay attention to it, to be safe, to be safer than sorry. And for young people too, generally speaking, most of the hospitalizations and deaths we see are among the older people, are among people with pre-existing conditions. But that doesn't mean that if you're young, you're not going to be affected by it.
Although the details of where the 16-year-old Quebecer who died contracted the virus are still unclear, for parents hearing the news, worrying about the rise of variants and sending their children to school, Montreal Public Health Director Dr. Mylène Drouin has this to say.
The measures that are put in place in school with mask and of course all the distanciation measures and the suppressive approach, we have outbreaks, but most of our outbreaks are still well contained, and most of them have less than 10 cases. So I think I would say to parents that schools are secure.
In Montreal, Alicia Rubertucci, City News.